Hey guys, I'm back. So we are finishing up this potassium. It may feel like it's been going on and on, but this is going to be a long video right now. So I have to really get you guys on board. I hope you got your lunch. Hope you emptied that bladder, because no bathroom breaks on this one, okay? So here we go. You know that we have this high potassium. We explained already the effects of that. I did want to give you a little bit more information about who could come into your hospital with a high potassium. It could be a burn patient. It could be a patient with chemotherapy and tumor lysis syndrome. It could be a patient with rhabdomyolysis. What do those two words have in common? Lysis, tumor lysis syndrome, rhabdomyolysis, right? Rhabdomyolysis. And so if those patients come in with those conditions, it means a destruction of muscle. Even your MI patient, your myocardial infarction patient, can come in with a really high K. So those patients have had the same thing happen to them. Destruction of living tissue. When you destroy muscle, you got to remember what I said earlier. I said that potassium was the highest intracellular electrolyte. Remember that whole thing? It's the highest intracellular electrolyte. So when you go destroying cellular tissue, live tissue, in the case of a chemotherapy agent for tumors, cancerous tumors, in the case of an MI, heart muscle, in the case of rhabdomyolysis, you've got destruction of, kidneys and all this stuff. And so when you destroy any living tissue, you get the K to come out of the cell and be very high. The other thing I mentioned earlier is that you want to remember three conditions: DKA, AKI, CKD. What do they all have in common? KKK. And they all need a what? EKG. So K's right in the middle. You got this. You can do this, okay? Now, I want to show you this packet because it's got a lot of information that we have to know. So we are moving along to the next page, which is Kayexalate. With Kayexalate, we already said it was an enema. Now you just have to remember what you've always known about the enema. And if you can, on this page, just go ahead and highlight birectal, right? So here it is. This is sodium polystyrene sulfonate, fancy stuff there. Little $4 word just to torture you. And you know that that's the word that's going to be on any test that anybody gives you. If they have half a brain and they made the test, it should have been all generic drugs. Well, do your thing. What is the positioning for an enema? Left lateral Sims, right? You kind of got to know the old stuff and combine it with the new stuff. So this patient gets into left lateral Sims. We go ahead and give them the enema. We tell them to retain it for 20 minutes, okay? So that's all you had to kind of focus on. And remember the brand name, K exits the body. What's the problem with it? It's slow. What do you tell your patient? Call off of work tomorrow because you're going to be pooping every 5 to 10 to 20 minutes. And so they don't need to get up to go to the bathroom every, 10, 20 minutes at their job. Their job's going to fire them. I'm like, what are you doing? Okay. Now, your next page talks about some diuretics, and that's important that you review that on your own. But the page after that, we need to discuss. You and me, baby. You and me. Here we go. Now, if you look at this page, you can clearly see that this is all about diuretics and lots of different kinds of diuretics. At the top of this page, I desperately need you to write potassium wasting. I need you to do that right now at the top. How does it look? It should look like that. Don't mess this up. When I tell you to write big and at the top, follow instructions. Okay? Now, so if you look at the diuretic water slide page, there's one more thing that, you just kind of got to know for the sake of, living your life. You've got to put the word underneath here, ototoxicity. So again, loop diuretics are ototoxic. Now, what the hell does that mean? That means your ears, hunty, your ears. You can't hear anymore if you go too crazy with this. So loop diuretics are ototoxic. If you look at the page, I think it's the coolest thing since beer in the can. Here we go up here. We have hydrochlorothiazide. What will you see at your respective hospitals? You'll see this, HCT it's the #1 diuretic for the hypertensive patient. Literally, it's the first drug of choice. It is not a loop diuretic. Please be careful. It is not a loop diuretic. It is a hydrochlorothiazide medication, and it's a thiazide diuretic. Okay? Then you'll see furosemide. Sounds cute, but that's not what's going to be on your exam necessarily, because you have another one that people don't know that well. So do me a favor, and you can turn back, but for now, do me a favor, because check this out. This is a very popular diuretic. It says bumetanide, so that's what you want to know. You do want to remember furosemide, but you want to know that this is more popular. Okay, so we'll do that in a minute, but for now, just stay with your girl. Now, you need to write furosemide, you need to write bumetanide, put that in there, right around in here somewhere, okay? Then you need to know how they work. OMG, for real, for real. You need to remember that this particular medication works in the loop of Henle by preventing sodium and water retention, right? That's how it works. You know that already. So if you are preventing sodium and water retention, then you're going to get rid of the salt. You're going to get rid of the water. And you know that water and salt love each other, so they're both going to go out of the body together. The only problem with that is it also lets the potassium out. This right here, this bucket, is a select all. It really, really is. Look what I did on my select all. I put my arrows, you see all of them down, and then I circled and highlighted the hyperglycemia, because it's under the down arrows, but it's actually an up arrow, right? So I made sure I put increased blood sugar. Now, why? Well, when you take all the water out of the body, the sugar's still there, okay? So you're gonna have a patient who you got rid of all those electrolytes, but the sugar is still there. Now, there's another electrolyte that will make, that will go down with this type of loop diuretics. Look what I wrote. Decreased calcium. That's a big one. So add an electrolyte, add your decreased calcium. Remember that that is the effect. Now, my favorite part of this handout is the little circle at the bottom. I want you to think of it like this. Any organ failure, any organ failure. So watch this. CHF, congestive heart failure. CKD, chronic kidney disease or renal failure. C for cirrhosis, which is of course liver failure. Any organ failure is what these medications are for. So look at the bottom. What does it say? CHF, cirrhosis, renal disease, and then of course it adds hypertension. If you remember what controls blood pressure, it's always been fluid or volume of fluid. So if you take the volume of fluid off this patient with the water, then you're going to go ahead and you're going to see a drop in the blood pressure. Kind of like common sense, okay? So you kind of got to know that. Now, turn the page out. If you turn the page, we are now on that newfangled $4 loop diuretic. So here's what I want you to remember. I want you to remember to put ototoxic at the top, right across the top. Again, don't fight with me, write it. Put it at the top. I want you to look at the very bottom of the page, because it's every freaking thing I said minutes ago. It says right here, bumetanide, and by default, furosemide, bumetanide, furosemide, promotes diuresis by what? Inhibiting, just like I said, sodium and chloride absorption in the ascending loop of Henle. I'm going to have to focus on that for a minute because y'all be doing crazy on steroids, so let me help you with this. I want you to know that if you think about the loop of Henle, you are talking about a part of the kidneys where if you prevent sodium absorption, then you're going to lose the salt, okay? Now let me say it better. Maybe I don't say, and let me read it, maybe I don't say inhibits sodium and chloride absorption in the loop of Henle. Maybe I say it like this: enhances the excretion of sodium in water. I just said the same thing. If I say it enhances the excretion of sodium in water versus inhibits the absorption of sodium in water in the loop of Henle, I said the same thing. Promotes the excretion or enhances the excretion of these two things, or inhibits, stops the absorption. You cannot get crazy. This is one of the reasons why I tell you to take this test slow. If you go slow, you will read every word and understand what you just read, because inhibiting the absorption is the same as enhancing the excretion. They're the same thing, but you got to know vocabulary, okay? Now, last thing we have here, I need you to highlight it and put stars around it, put some stripper glitter on it, do whatever you got to do. Daily weights, people. Check a blood pressure, folks. Look at it. Decreases potassium. There's that ototoxicity. There's that high blood sugar. Wow. Everything I've been saying. Hello. Now, I love this page. Almost done. I swear to God, I love this page. So watch this. What are those? Lungs. Put pulmonary edema. It works on that. What are those? Kidneys. Put AKI, CKD, because this works on kidney failure, acute and, of course, chronic. What is this? It's a heart. Put your CHF. Okay. Now, the only thing that's not on here is the liver, and that's because we have to use it with another drug, but you can also remember your liver failure. So, pulmonary edema, and you can put one more thing. Put ARDS. ARDS is another good one to know. All right, I'm done with y'all. I'm going to turn the page. Stay put. Don't you? I told you no bathroom breaks. See, you hard-headed.